Hi, everyone. My name is Ann Perry, and I am the Michigan Area Director for AFSP.
Hi, and I am Corbin Stanley. I'm the Board Chair and Public Policy Field Ambassador for AFSP Michigan.
And we just wanted to take a few minutes to come to you live tonight and in advance of our State Capitol Day, which is a week from tonight, to kind of talk about advocacy. And, we know that even the word advocacy can be somewhat intimidating to people. So we wanted to kind of break it down and let you know that it doesn't have to be intimidating. So Corbin, let's start really simple. What does it even mean when we say that we advocate for suicide prevention?
Yeah, so being an advocate is really just about using your voice to share your story and your experience to talk to legislators about the importance of mental health and suicide prevention legislation. So we combine research and data and everything, but more important than that, it's just about people using their voice to share their stories.
And at AFSP, we talk a lot about being a field advocate. So for those that don't know, what does that mean? What does it mean to be an AFSP Michigan field advocate?
Yeah, so a field advocate is a specific set of volunteers who are engaged in our public policy work. And so what that program is about you go to our website and you can sign up to be a field advocate. And then you'll get some emails from us and some emails from our public policy office in Washington, D.C. with some action alerts and updates around specific policies about mental health and suicide prevention, both in Michigan and at the federal level. And what's really nice about the field advocate program is when you sign up and you receive those alerts, you can click to our action center where there is a template for you to email your legislator. You can find the contact information for their staff. You can call their offices. You can email them to talk to them about why you care about these policies. And so all of the work is done there for you. You just enter in your name and your address. You can fill out some of the customizable pieces of the template, and you can email your legislators. So we currently have 900 field advocates in Michigan right now.
And so it's made really easy. So even if somebody doesn't really follow along with politics or maybe it doesn't have to be something that's big and scary.
Right. Yeah. Policy work and advocacy can seem sort of intimidating, but we really break it down and make it very easy. If you do want to meet with legislators, we provide some talking points and fact sheets and give you all the information you need to work with your legislators. And so you can visit our website and sign up to be a field advocate at afsp.org/advocate. And yeah, we welcome anybody who's interested in doing that work.
All right, so let's talk about State Capitol Day. So we know that it is on March 10th, which is a week from tonight. Can you tell us a little bit about what folks can expect from this evening of advocacy?
Yeah, so our State Capitol Day is an annual event that we host every spring. And this year it's going to be a virtual event. And this is an event where we bring volunteers from across the state to Lansing to advocate for mental health and suicide prevention legislation. And so next week on March 10th, we'll be hosting our virtual State Capitol Day event. And during this event, we'll talk about sort of the scope of suicide and what we do as an organization around stopping suicide. We'll talk about some of the statistics and research surrounding suicide in Michigan. We'll go through sort of an advocacy 101. So talking a little bit about how a bill becomes a law. We'll talk about sort of the legislative process broadly and some of the work we do with AFSP. And then we'll talk specifically about those particular policies and legislation that we'll be advocating for. And those will include things like mental health parity for insurance, making sure that they cover mental health in the same way they cover physical health, ensuring that educators in our public schools are trained in suicide prevention, and any other number of policy priorities. So it'll be a great day for anybody who's experienced in policy work or is just interested in getting started. We will have information for anybody who's interested.
And is it open for anyone to attend? Is there an age, anything like that we need to know about?
It's open to anybody who's interested in attending and just wants to learn more about the work or wants to meet with legislators. Even if you don't want to meet with legislators, but you're just interested in learning more about the advocacy work, you're welcome to attend. Last year, we engaged with some students from Howell High School who were able to come and advocate for suicide prevention and why it was important to them. And so we're doing more work to engage with high schools and engage with younger folks to encourage them to use their voice. And we heard some really great feedback from the Howell High School students about how they felt empowered by attending State Capitol Day last year. Some of them will be attending next week as well. And they felt that they were able to use their voices to share their stories. And the legislators love hearing from them as well. So yeah, anybody and anyone who is interested is welcome to attend.
Excellent. So we know that registration is required. Is there a cutoff?
Yes, registration ends on March 8th. I believe it's at noon on March 8th. So we encourage you to register this week if possible. And then we will send out some information next week to those who register with the Zoom link and meeting details for those who are interested in meeting with legislators. But yeah, deadline is March 8th.
And then lastly, can you break down why advocacy is so important? How does this work for us? What does this mean for us as an organization? How does this work affect other areas of our work? Can you kind of give us a snapshot of that?
Right. So advocacy is a huge part of our work. As many of you know, our work aims to save lives and bring hope to those affected by suicide. And we do that through research, education, and support and advocacy. And advocacy is critical to all of those other pieces. We couldn't fund the research around suicide if we didn't have the complemented research from the National Institutes of Mental Health, from the CDC, from SAMHSA. All of their work and programs around suicide prevention help to support the work that we do. We wouldn't have the policies in place to provide suicide prevention education in our schools and many of our communities, to our veterans communities, if we didn't have the support of those organizations as well. And so we know that advocacy touches on all of those things. And we've seen some really great policy wins, both at the federal level and at the state level. Nationally, we've seen the passage and the signing into law of the National Suicide Hotline Designation Act, which will create a 3-digit suicide crisis line starting in July of next year. That took a lot of work, years of advocacy, and constituents talking to their legislators to make that happen. We've seen some increased support for suicide prevention research at the National Institutes of Mental Health and the CDC. We've seen increased support for prevention programs for our service members and veterans and their families. And then at the state level, just in the last 18 months, we've seen 3 suicide prevention bills passed in the state of Michigan. Last year, there were about 75 bills passed federally and at the state level in all of the United States, and 3 of those were here in the state of Michigan. And so we're really proud of that. One of those was establishing the State Suicide Prevention Commission, which is the first state level commission about suicide prevention in Michigan. The second is the Michigan Cares Hotline, or MyCal, and that will be a mental health crisis line that's going to be piloted in Oakland County and in the UP. And we'll be going statewide after that pilot testing, and that'll be a mental health crisis line accessible to anybody in the state. And then the third is the Save Our Students Act that was introduced by Representative Schroeder, and that requires K through 12 schools, or those serving students in grades 6 through 12 specifically, to print a suicide prevention hotline phone number on all student ID cards and to display suicide prevention materials in their schools. So we know that advocacy works. We know that sharing our stories in combination with what the research and the data say, and bringing that all together to talk to our legislators, can make a difference, because we've seen it happen.
That's amazing. It really is truly amazing work that we're doing. And I do have to give a special shout out to you, Corbin, for all of your work that you do here to advance our advocacy efforts in Michigan. For those that don't know, the commission that Corbin mentioned, he serves on that commission for the state. He was appointed by our governor. So you're an absolute rock star when it comes to this work. And we're so grateful for everything that you do. So make sure to follow this link and register for our State Capitol Day next Wednesday at 6 p.m. And we will see you then. Thank you, everyone.
Thanks, everyone.